Hello, and welcome to Philadelphia. My name is Amelia Conley. This is my colleague, Beth Edwards, and we're research managers at the Ehlers-Danlos Society. So we're very excited to share some updates and information with you today. We have a few slides to get through, and we're out in the foyer if you have any questions for us following our presentation. So I'll go ahead and get started. Over to Beth for our research roadmap.
Hi, everyone. So I'm going to be catching you up on our research priorities, for those of you who don't know them. I don't think I need to tell you guys that obviously we're talking about complex conditions that are still incredibly misunderstood. And so we developed a roadmap for our research priorities, and that is based on our 5 key pillars, which you can see there. Education, basic sciences, epidemiology, therapeutics, and social sciences. And these govern our core internal and external research programs. How did we come up with these? We based them on discussions with researchers, industry experts, donors, board members, all of our coalitions, but most importantly, you guys, our community. And they cover everything from genetics to diagnostic tools, social sciences to education. And yeah, so it's a pretty good thing. If you want to check it out, there is a link on the slide, and I believe you guys will have that. But yeah, and to you.
So as you can imagine, from such a roadmap, we have a few projects going on. So we wanted to take this time to just share with you a bit of an overview. I know you've heard in Laura's talk at the beginning a little bit of what we're doing, but we wanted to share some of the research that's being undertaken and also supported by the Society. So we have a fairly diverse portfolio of work across our internal research and the work we support externally. Some of our own research includes things like the DICE registry, which is a global tool for research that's aimed to advance research and collaboration in EDS and HSD. Enrollment is open if you'd like to join, if you've not already. The core surveys are available for participants all around the world. Supplementary studies like the COVID-19 survey and others that are based on eligibility are also available with more on the horizon. So if you're signed up to the registry, you can view all your available surveys in your survey queue. If you're not yet joined, please come see us and we can tell you all about it. We recently launched our platform for researcher requests for the DICE data. Those are also open. So researchers wanting to use registry data are able to access those in one of 3 tiers and utilize this data to make the progress that we also want to see. Next, we have the criteria study, which is aimed to investigate the frequency of signs, symptoms, and associated diagnoses in individuals with musculoskeletal chronic widespread pain of any origin. And now that I'm through that sentence, I'm not nervous anymore. Recruitment for this study is active and is being facilitated by specific study sites. We're about 24% of the way there, so we're really excited to see the progress this study makes in the coming months and years. Next, we have the HEDGE study, which many of our community are familiar with. This study aims to identify genetic markers and blood characteristics linked to hypermobile EDS, advancing our understanding and potentially aiding in developing a diagnostic test. The HEDGE team is currently analyzing the data, working towards publication, and we anticipate the updates will be coming soon, which we're really looking forward to. And as you can see on our slide, there are some offshoot studies of HEDGE as well, which delve a little deeper into specific topics within that project scope. We also support studies in a range of topic areas, including biomarkers and building a database of EDS variants. So we have some really important and exciting work already existing, and Beth's going to share some of our upcoming studies that will be new.
So yeah, some of the research that we are undertaking and some of our new projects in 2024 include our global biobank, which Lara's already mentioned, the aim of which is to remove the geographical and financial barriers that a lot of researchers face when collecting samples. The natural history study, which is a retrospective review of data going back to about 2001, I believe, and using that data to shape a prospective study. And importantly, the Road to 2026, which is another one of our new projects, which is a path towards progress, where we're looking to update the 2017 International Classification of EDS and HSD, as well as looking at diagnostic, assessment, and treatment pathways.
So within our, does this work? Okay. Within our research program, we also have the Research Grants Program. We're really proud of this program and all it's been able to contribute. Since 2018, this program has funded over $4 million in research, and this funding includes major and minor grant rounds. We support large and small research teams, and we're proud to have funded research involving every type of EDS and HSD and a wide range of specialties, including genetics, basic science, social science, and care delivery, to list just a few of these examples. We know this is an area that many of our professionals are particularly interested in, so please do visit our grants webpage that's listed there for more information, if that's of interest to you.
And last but not least, we have the International Consortium. This is a 200-strong group of experts who are members of our International Consortium that work across 18 working groups. They have been busy, let me tell you that, very busy. They have produced 5 papers in the last year, from pregnancy guidelines, pediatric guidelines. They've been pretty busy. And they are supported by the EDS Society with the administration, planning, all of that kind of jazz. And they are currently working hard on the Road to 2026 publications. So if you want to find out any more about the International Consortium, the work they're doing, or the Road to 2026, there are links on the screen as well. There we go.
Thank you. Like I mentioned previously, if you do have any questions, our research team is available. We're just outside that back door, kind of to the left. We're happy to talk about this work and our other work that we're pursuing. So thanks to Beth for helping me out with that presentation. And thank you for your attention. I'm now delighted to welcome to the stage our keynote panel titled Equitable Care, Empowering Marginalized Voices in EDS and HSD. Professor Lara Bloom, President and CEO of the Ehlers-Danlos Society, will be joined by Dr. Akhila Kadei, Michelle Jalali, Sabra Thomas, Mars Lombardi, and Danielle Medina. Dr. Akhila Kadei is the founder and CEO of Change Kadei, an organizational development consulting firm that embeds belonging into company culture and strategy. Will do. She is a passionate advocate for dismantling white supremacy and supporting marginalized communities. Dr. Kadei is also a member of the Ehlers-Danlos Society's board of directors. Michelle Jalali is the Director of Diversity, Equity, and Inclusion for the NBA Portland Trail Blazers and owner of Jalali Consulting, LLC. She's also a member of the Ehlers-Danlos Society Board of Directors, and Michelle looks forward to emphasizing the need to remove barriers to access and quality care across various demographic groups. Sabra Thomas is a patient advocate diagnosed with hypermobile EDS. Her journey of self-advocacy began at a young age, and she continues to educate and support others within the EDS community. Mars Lombardi is a patient expert, disability justice activist, and current candidate for a master's in speech-language pathology. Their work includes legislative activism, public health education, and accessible arts education. Finally, Danielle Medina is a disability and rare disease advocate. dedicated to raising awareness about vascular EDS and promoting accessibility in various sectors, including fashion and entertainment. Together, they will discuss how to ensure equitable care for all EDS and HSD patients, particularly those from marginalized communities.